broadly speaking, I find there are two big categories for people who, in terms of why people struggle when they know what they should be doing, but they have difficulty doing it. The first is the failure to turn what they know they should be doing into habits. They can get excited for a period of time and make some big changes, but then life happens. And when difficulties occur or challenging circumstances come their way, they don't stick to their basic healthy habits. And I think that our life is essentially the sum of what we repeatedly do each day, what we think and what we do. So if I can get patients really starting to think about habits and making some of the skills and behaviors, things that they do on a daily or weekly or consistent basis, and then building upon those habits, then I think we can gain traction. So what's one example? Weekly shopping and batch cooking, right? If they can just build that into the rhythm of their week, and plan ahead, and every week do their shopping on the weekend and then batch cook, then that's a habit that's gonna, you see people 20-30 years later is still serving them well. Just having 2 or 3 breakfasts that they just kind of repeat over and over and over again, it just becomes a way of living, a way of being. And what I tell them is that the more that they do a certain behavior that's new for them again and again, it becomes that much more automatic, like brushing your teeth. You don't even need to think about it. For me, breakfast, it's oatmeal, and every now and then I'll have something different, but it's become so ingrained and so automatic that that's just what I eat every day. And I don't really even need to think about it. It becomes almost like muscle memory of how to make it. And ultimately that's what I want from my patients who are eating a healthy McDougall diet. It's like muscle memory. It's become automatic. The other reason that I find that patients struggle to turn what they know into consistent action is the power of emotions. And that's why I give a talk during the program on emotional eating. I've just come to see that eating is a common coping tool that patients use to deal with difficult emotions. So whether it's stress at work, loneliness, depression, anxiety, grief over the loss of a loved one, for some people, food is the drug of choice. It's their equivalent of alcohol, or drug use, but instead they're turning to food. And the thing with emotions is that they can be so powerful that they hijack, in a sense, our logic, right? What we know in our left brain. When the emotions come in, that can just kind of go away, and we're not really thinking in our left brain anymore. So the key with that, I think, is to help patients come to not only understand their emotions better, because a lot of people just don't have much experience. They're not very emotionally in tune, so they're not even really able to identify or label how or what they're feeling. So not only being able to understand and label and name what they're feeling, but then learning how they can cope with those emotions in a healthier manner that does not sabotage any success that they've achieved up until that point. So learning that another coping tool for dealing with stress at work that does not involve eating unhealthy, high calorie dense snack food when they get home. And for each person, that's going to be different. Some of the most popular ones that patients have told me work for them is going for a walk in nature. There have been many studies that have shown the benefits of nature on our overall sense of well-being. It's almost like the trees and the plants just suck out the stress and frustration from every fiber of our being. And so it's very, usually people feel much more settled after that. So going for walks in nature, meditation is a very powerful one. Essentially, what you want to do is just disrupt that, that circuit, that emotional circuit that says stressed, anxious, food, right? If we can just disrupt that by a walk in nature, by doing a 5-minute meditation, for people who are spiritual, doing praying, right? Journaling, right? This is my journal. This is my most recent journal. This was my last journal, right? Journaling is not only a helpful thing for understanding your emotions better, but then also just kind of working through things and taking a healthier, more constructive approach to difficult emotions. Some people are physical, so going for exercise is an obvious one, like a run, dancing. A big one is music, right? Because music taps into our emotions as well. So if we can, listen to a song or play some music that helps us express our emotions in a healthy manner that does not involve food, then that's a good, that is also good. Another really popular one is connecting through conversation. So I think, again, going back to Alcoholics Anonymous, one of their big features that is a large reason for their success is the whole sponsor aspect of the program, where when someone feels tempted, like they're gonna have a beer or have a glass of wine, that they're actually able to call someone before they do that. So similarly, if you feel like you're about to engage in unhealthy eating pattern or even binge eating, we've had a lot of patients who have come to our program with binge eating. If you have someone on your phone, 1 or 2 people that you can call to just talk through in that moment of temptation, does it guarantee that you're not going to binge eat or eat unhealthy food? No, there's nothing that's a guarantee. But does it increase the likelihood that you're going to be able to resist it and take healthier action? Absolutely. So the more options that we can help a patient develop for them to choose instead of unhealthy eating, the less likely they're gonna binge eat or eat unhealthy foods. And over time, those new behaviors and new ways of responding to difficult emotions will become more entrenched and sort of habitual.